Hi, hello everybody. Welcome to Viva-Mundo's webinar. Today we are heading all the way over to Australia, the other side of the world, for a brilliant presentation from Up Education, Darwin University, which will be great to hear from them and to hear, reasons why you should study nursing abroad and how this can fast track you into a brilliant career. Now, please do ask any questions throughout the whole webinar. That's what we are here for. We are here to answer your questions. We have a question box at the bottom of our screen, if you can see that just there, and ask all of your questions there and we will get to them either during the webinar or probably right at the very end. I think is the best way to go about this. Hello to everyone on Facebook. We will be getting to your questions as well. Do register at the link that is below and then we can get your questions in as well. Okay, I'm going to hand this over to you, Nicole, and we will speak soon.
Thank you very much. Hi, I'm Nicole Norman. I'm the Undergraduate Nursing Academic Lead located at Darwin University, and I'm coming to you from Darwin. But what's really great about the College of Nursing and Midwifery is that we're also located in Alice Springs, Sydney and Brisbane, and I'm going to share with you some of our key points about our course and what we can offer you to become a registered nurse. So the first thing is we have a multitude of programs in our college, but we've got two that lead to registration. One is our undergraduate Bachelor of Nursing program, and the other is our Master of Nursing practice for registration. So what's really important about a Bachelor of Nursing degree is that it is accredited by the governing bodies here in Australia. So we have accreditation and registration with the Nursing and Midwifery Board of Australia, and that's governed through the Australian Health Practitioner Regulation Agency. So as a student at doing the Bachelor of Nursing, you'll be registered with the Nursing and Midwifery Board as a student nurse. And that enables you to go out on placement in registered healthcare facilities and practice your learnings in a real world environment. And I'll talk a bit about that in a minute. Our course is also accredited by the Australian Nursing and Midwifery Accreditation Council, and that undergoes accreditation every 4 to 5 years. And that's to ensure the best evidence-based practice is being taught and up-to-date standards for the Australian healthcare setting. So we also are mapped to the National Safety and Quality in Health Service Standards. Definitely is a mouthful. And so that mapping ensures that the governing quality assurances have been embedded throughout our program, as well as in your learnings. So you're ready to take those learnings out into the real world as part of your registered nursing practice. So what's nursing here at CDU? So as I said, we've got undergraduate and postgraduate courses. We also have a big education arm. We also practice in acute care, community care, public and private sectors, and also specialised areas. So you're not just limited in our program to big hospitals. We can have included in our program right through to community healthcare and primary healthcare, Indigenous healthcare, and also our private and public sectors as well. So you can experience a very broad range of health facilities that support the registered nursing scope of practice. And I've put some wonderful pictures up here. These are of around Darwin and Palmerston Regional Hospitals, which is outside of my campus, and some of our wonderful clients that you'll get to engage with during clinical placement here at CDU. So our research arm, which we encourage our students in our programs to become engaged with and to participate in, we have 4 key groups. And the first is our Molly Wallaguga Research Centre, which focuses on First Nations birth on country. So that's actually delivered out of our Alice Springs campus. We next have our primary healthcare research group, our mental health research group, and our chronic disease, cancer and ageing research group. All 4 groups are highly recognised and published internationally and are led by professors in their field. And so as students, you'll be able to firsthand reach out and communicate with those professors and see how you as a student can get engaged in research projects or be a participant yourself if that's something you're really interested in. So I suppose the most exciting thing about doing a Bachelor of Nursing is clinical simulation. And I've popped some images up there for you to have a look at. for our students when they come in on campus and they engage in what we call simulated learning in a clinical laboratory suite. So it has specialized equipment that represents the clinical spaces that you'll go out on placement. So our mannequins are computerized, so they talk, they react, you can inject them, you can do everything that a nursing scope would allow you to do on our mannequin. So you can actually see what happens when you don't do the correct, say, procedure, or you don't follow an assessment through. Our mannequins can react, so you can then learn what happens when something goes wrong, because I think that's really important that we can learn through that simulated learning without hurting anybody. So we do real life simulation like you're on a nursing shift. So you get to learn about time management, troubleshooting, patient interaction, shift planning. So it really does prepare you for that real world experience. We also do it before every clinical placement. So you'll come in, you'll do a simulated practice in one semester, and then the next semester you'll go out onto placement. And you'll do that each year in the program. So that way we're adding more skills and more scope in your simulated space in preparation for the next level of clinical placement, which is really important. All our simulated suites are supervised by registered nurses themselves, so they can give you hands-on support and supervision, which is what you'll experience out in the real world. We have simulation labs located in Darwin, Alice Springs, Sydney, Brisbane, Melbourne, and Perth. So part of the program, of course, is teaching and learning, and we have both classwork that is online and face-to-face. Now that's really important because we want to establish resilience and self-management and self-evaluation. So by putting some of our units online only, it enables you to adapt to that online world, have some resilience and troubleshooting in order to navigate the course. Please don't get me wrong, online learning doesn't mean you're on your own. It just means that we're down the corridor or via an email, a phone call, a Zoom, just like we're doing now, in order to communicate and support with each other. So there are some classes that will be online and other classes that are face-to-face on campus with either your unit coordinator, your lecturer, or what we call a clinical liaison lecturer. So they are nurses that are currently working in the health field, doing shifts in particular environments, and also acting as a liaison lecturer to get you ready for that clinical space. So study is self-directed. So all the information is available on the learning platform for you to navigate to your needs. So for instance, you might like to read a little bit ahead in order to understand a topic. You might like to read really wide to understand a topic. You can do that because the materials are ready and available for you to self-direct. We give you a schedule, which we recommend, but it's really important that you tailor that to what you need and your current environment. All our lectures are recorded. So if you miss something, or if your lecturer is like me and I talk really fast, there might be something you've missed or you might want to make further notes about. They're all recorded for you to access at any time in the unit. And that's really great, especially if you're someone that might not like morning classes, but you want to be able to, stay awake and take notes. The class is recorded so you can go back and watch again in the evening where you might be a little bit more sprightly. So that's really great. So we offer tutorials. So they're interactive. So you're in class working in groups, working with your lecturer or your tutor in order to develop your understanding, develop your critical thinking, and really to expand your knowledge. So the tutorials work really great, and we have really good feedback from group discussions with students and staff. We do clinical teaching, which is the clinical simulation I talked about. So they're in nice small groups. So usually about 20 students in our simulation lab, and you'll be partnered up with a different person each day of your block. And that way you're, I suppose, learning your communication and adapting the way you interact with your colleagues to improve your professionalism and that's under the guidance of our registered nurses. And obviously our learning platform is accessible 24/7, which is really great. You can access it on a tablet, on a smartphone, and obviously a desktop computer, which I think makes it really great. If you don't like sitting in the library, you can access it from anywhere, which is great. Now, a couple of things to really acknowledge when thinking about the Bachelor of Nursing program is we have what's called inherent requirements. And these are things that you'll need to be able to, I suppose, confirm when you come into the program to ensure that you meet the standards for our practice. So obviously that is around ethical behaviour, behavioural stability, legal implications, communication standards, cognition, sensory ability, strength and mobility, and also sustainable performance. So these are really important because firstly, you're going to be working with the general public. So it's really important that you have a good ethical behaviour and also a behavioural stability, because you'll be working where people are really, really sick, or people that will be dealing with disabilities, or people that are coming out from physical or mental illness, transitioning back into community. So it's important that you're able to, I suppose, approach that in a professional manner. The other one really important is the strength and mobility. Nursing's not a sedentary job. There's a lot of walking, a lot of standing, and there's a lot of engaging with a patient and trying to, I suppose, attend to our cares. So it's really important that you're physically able to do that. So some limitations we can put in place if you've got a short-term injury, but anything that's long-term, we'd have to have a conversation and a chat about, but we can make some minor adjustments, but to ensure you meet the course requirements. So there's more information on our inherent requirements on the CDU College of Nursing and Midwifery webpage. So the other thing that's a requirement from the Nursing and Midwifery Board of Australia is the English language requirement for nursing. Now, all students, regardless of whether they're domestic or international, have to acknowledge the English language level, and I'm obviously struggling with it, in order to enter into our program. And I'm going to let Mark from Up College talk about that a little bit more after my presentation. But this has been mandated by the Nursing and Midwifery Board to ensure that you get optimum interaction with your learning materials as well as your patients throughout your course, and to ensure you're at the level needed to enter the workforce on completion. So that's why they're there, and it's a requirement for all Australian Bachelor of Nursing programs. So what is our program all about? So it is a 3-year full-time or equivalent program. So that's running 2 semesters per year across 3 years. It has 880 hours of clinical placement in diverse settings. Now, those placement hours are unpaid and they are at a full-time rotating roster. And I know you're probably thinking that's a lot. We break it up across the 3 years, and you work the rotating roster that your preceptor, the person that's looking after you on placement, what they're working. So it enables you to adapt to what real-world nursing is all about. So the shortest placement is 2 weeks, and that's our mental health placement. And then we have an average of 4-week placements, and then you end the program on an 8-week placement, and that's to prepare you for the transition to the workforce. And what's really exciting about that 8-week placement, it's like a job interview. So they get to know you, they get to love you, and then they can offer you employment at the end. It also enables enough time for you to develop and grow your skill sets. And if there are any deficits, it enables us to put lots of supports in place, and you have plenty of time to develop any areas that you need to, or that have been identified as concerning. So that's really great for the final placement in the final semester of the program. And you won't be doing any large volume of theory work in that space. So that last semester is really about finalizing your clinical skills and transitioning into the workforce. So as I said previously, the simulation labs the sim blocks, as they said for short, are offered at each year level of the program. So you do 3 in total, and they are a block. They're 4 days, and that's to get you in that mindset and that behaviour of what registered nurses do. So the program is really focused on critical thinking and, I suppose, linking that to clinical practice. So it's not just about I can do, but it's about why am I doing that? And how is it beneficial to my patient or my client at the time? And we do that by using evidence-based guidelines and standards. So you're not just doing, but you're also knowing and understanding, which is great. On completion, all successful students are eligible for registration for the Australian Nursing and Midwifery Board to be a registered nurse. And what's really exciting about the Bachelor of Nursing program here at CBU is that we're ranked 3rd for graduate salaries, so the 3rd highest of graduate salaries across the country, and 83% of all our graduates enter full-time employment on completion. So that's just full-time. Some of them will be doing part-time, but that's really exciting for our graduates and our registered nurses entering our workforce. So the best I've saved till last is because we're located in the beautiful Northern Territory, we offer all of our students the opportunity to do remote placement in remote communities. Now, those communities can be as little as 2 to 3 hours away from the campus, or they can be several hours, a plane ride or a ferry to get to a island community in which you'll be able to immerse yourself in Indigenous culture for the area that you'll be doing your placement of. The placements are run by the Northern Territory Government in collaboration with the Top End Health Services, and they provide transportation, accommodation, and registered nurse supervision. So the placement opportunity is really exciting, and it's linked for people that are really interested in both Indigenous culture, but also the social determinants of health for those in our regional and remote areas. Because a lot of those communities need to be able to be self-sufficient as far as their healthcare needs. So having highly qualified registered nurses working out there helps them achieve this. So you'll be able to go out there on placement and experience this as well. And of course, I'm a bit biased because I'm here in the Northern Territory, but here is one of the beautiful swimming holes that you'll get to swim during the dry season, which doesn't have crocodiles in it during the dry season. So you'll be able to enjoy that on your downtime on placement, but also you'll get to do that with the community members. So you'll really immerse yourself in the community. So that's all I have about the nursing program. I want to reiterate that the program is really diverse. There's students from all over the world and all over Australia. We have a varying ages, so we have a really diverse group of students that are very engaged. They love to participate in study groups, they love to participate in group assessment activity, and they really do support each other, which I think is wonderful and valuable for registered nurses. So please ask questions, but I'm going to hand myself over and stop sharing my screen. So Mark, it's all yours.
Good afternoon, everyone. I'm hoping you can hear me. And yes, Sue's saying that you can. And I'll just start our presentation here. So my name is Mark Holt. I'm the head of college for our CDU International College program. So this might be a little bit confusing, but hopefully it will become clear as I go along. The first year diploma program in health is an alternative way to join the wonderful nursing program that you've just heard Nicole speaking about. And one exciting thing about it is that it will not take you any extra time to graduate. So you will end up with the equivalent of the first year program of the Bachelor of Nursing, and then you'll enter directly into the second year of the Bachelor of Nursing program to finish afterwards. So we run the program from Darwin as well. So I'm in Darwin, and I'm actually sitting in the waterfront campus, which is pretty much the centre of Darwin City. And Nicole's been speaking to you from the main CDU campus, which is out at Casuarina. So if you do the Diploma of Health through us, then you'll come out into the centre of the city for your first year, and then you'll join the rest of the program probably at Casuarina. But as Nicole mentioned, there are other possibilities as well, depending on space in other cities in Australia. So we're about 12 kilometres away from each other between Casuarina and the waterfront, both based in Darwin City. So our international college can help you in two ways. The first way is that perhaps you haven't finished your high school yet, but you're keen to come over to Australia and get started in an English language program and do the equivalent of your final year at high school with us through our foundation year. So if you complete the foundation year, and that's the top row that you can see there, then providing you pass during your foundation year IELTS of 7, you can enter directly into the Bachelor of Nursing and progress. So the only difference with the foundation year is that you're doing your final year of high school here in Australia. In the case of the borders being closed, you can do this online and offshore as well. So that's our foundation entry into the Bachelor of Nursing. However, we now have a new program that is about to start in March of next year. And that is our diploma program. And what it is really aimed at is for students who meet the academic requirements to enter a bachelor degree, but their IELTS is not yet at level 7. So you can enter our Diploma of Health program with an IELTS of level 6, and then providing you meet the IELTS level 7 by the end of the year, you can then progress on into the Bachelor of Nursing program. So that's really aimed at students who they've been keen, they've been aiming at entering the Bachelor of Nursing at CDU, but they haven't yet reached the IELTS level of 7. So as I said, it starts at an IELTS level of 6. And as you'll see, we have built into this program study that will enable you to reach that extra whole level of IELTS and then enter into the Bachelor of Nursing. But as you can see, it's if you do the diploma level here or online, and it can also be done online in your own country while the borders are closed, then you can carry on into the second and third year without losing any time, and then begin your career as a registered nurse. So this is how the Diploma in Health program works. It's designed to teach pretty much the same as the first year Bachelor of Nursing. Now there's one difference to this, and I'll explain that in a minute, but it has built into it additional literacy, numeracy, and English advancement skills. So the idea is that the diploma will prepare you for that practical placement and the clinical simulation that Nicole talked about, and then you'll enter the second year of the Bachelor of Nursing. So you will study the same thing as students in the first year of the Bachelor of Nursing do, but you will have smaller classes as well as the opportunity to improve your language and pass that IELTS test. You can also progress from the Diploma of Health into the Bachelor of Health Science, the Bachelor of Occupational Therapy, Speech and Language Therapy, and Bachelor of Public Health. Now, we won't deal with those today, each of those have different levels of requirements around English language, but they are alternatives for a student that might start thinking, I want to go into nursing, and then for whatever reason decide, actually, I'm interested in health, but I want to go into this different avenue. One of those reasons could be that you don't actually make the IELTS level 7 at the end of the year. So there are alternatives for that to happen. So the first year diploma in health takes 1 year. There is one intake only at the beginning of the year, and that intake for next year will be on the 7th of March. The fees are listed there, and we can give you some more detail about scholarships a little bit later on in the session. And the English requirement to start the diploma is IELTS of 6. To go directly into the Bachelor of Nursing, you would need an IELTS of 7. So really that's one of the most basic differences between the two pathways. Now, there are academic requirements, and those academic requirements will depend on which country you're coming from. They are listed here, but your agents and Up Education can give you further information about that, and we'll check those when you come in to do your application for enrolment. So how does it work? I'm sorry, the writing on here is quite small, but hopefully you can see some of it, but I'll just go through it fairly quickly. When you're in Australia, a full year of academic study is 8 units, and you can do four units, well, you need to do 4 units each semester. So the year takes up normally just 2 semesters. So in your first semester, you will do the same as the nursing degree in their first year, which is professional practice, communication for person-centered practice, and anatomy and physiology. That is 3 units. However, you will also have an extra unit, which is academic skills, which is focused on the language you need for the rest of your degree, as well as helping you to improve your IELTS score so that you're ready to sit your IELTS examination to get that level 7 before you go on. It also includes a numeracy component to help you with the numeracy requirements for the nursing registration. Now, you are not registered at this point. You're simply working through the academic requirements before you can be registered as a nursing student at the end of the 2 semesters. In semester 2, you will do 3 of the units, 3 of the 4 units that the Bachelor of Nursing students do in their second semester in the first year, and that is primary healthcare, Aboriginal and Torres Strait Islander health, and a second unit in anatomy and physiology. And the 4th unit you do will be the second unit for English and academic skills. So after 2 semesters, you will have done 8 units, but only 6 of those are units that will go across into your nursing degree. So what are the other 2 units? Well, the other 2 units are the simulation and the professional experience placement, which are part of what Nicole was speaking about, that are so special for the nursing degree. Now, we do not teach those. You need to become part of the Bachelor of Nursing before you can do those, because they're very specialised. And you also need to have passed the IELTS 7 level. You do this by catching up in what's called the wet season. So the wet season is our November, December, January, February at the end of your year 1. And once you are past your IELTS of 7 and you've passed the first 2 semesters, you leave our diploma and you enter directly into those last 2 units, which we haven't taught you, which are part of the Bachelor of Nursing. And then you will become registered as Nicole was speaking about, and you will have access to, well, you'll be treated exactly the same as all the other Bachelor of Nursing students. You'll then carry on into year 2 and 3, the same as everyone else. But the difference is that you've had those first 2 semesters to improve your English language ability, so that you've passed the IELTS level of 7, and it's given you the opportunity to do that while you're doing an English medium course. Hopefully you'll be in Australia for most of it. And at the same time, you'll be improving your English language by learning the different nursing units at the same time. So there's a lot of benefits to doing it, and you're much more likely to meet the requirements of the IELTS 7 by doing this study, rather than just staying at home and continuing to try to get from an IELTS 6 up to an IELTS 7. And apart from that, you're not spending an extra year. You have gained all the credits that you need in your year with us, along with the intensive wet season of that placement and the simulated block. So that's the benefit. It's exactly the same number of years. You're just doing it from a different pathway. You are doing 2 extra units, which you do pay for, so the cost is a little bit more, but not much more, and not compared to doing a whole extra year. So I guess a simple way of showing it is on this slide. You are entering the Diploma in Health. To progress from it, you need an IELTS of 7, but to enter it, you only need an IELTS of 6. You also need to pass all of the units in the Diploma in Health to move on and do those simulation blocks, and then year 2 and 3. When you finish year 2 and 3, exactly the same as Nicole was talking about, you'll still have done all the 880 hours of placement, and passing all of those, you then will register as a registered nurse with the Nursing and Midwifery Board of Australia. So the outcome's exactly the same. It's just a different level of entry and a different way of helping you get through that first year and get through that IELTS 7 requirement. You will do all of your first year here in Darwin. There are possible options of Sydney and Perth afterwards for your 2nd and 3rd year, but that is subject to university approval and capacity at those 2 other locations. But for the Diploma of Health and for the intensive and the simulation block at the end of the first year, that is all here in Darwin. And I'm a bit like Nicole. I don't understand why anyone would want to leave Darwin and go somewhere else. I think it's one of the most beautiful places in the world. And here's another way of looking at it. You can see that semester 1 in the Diploma of Health. Now it says 30 credits here in your first semester. You're actually doing 40 credits, but only 30 credits of that gets onto your Bachelor of Nursing degree. The other 10 credits or 1 unit is part of the extra English language requirement that you're doing. And then the same in semester 2, and then you catch up with your extra 20 credits in this block here, December, January, February, of the simulation and the placement. And then everything else is exactly the same. In 2023, you would go through and you'd do semester 1 and semester 2, but you'll get a nice long break between semesters, and then your year 3, semester 1 and semester 2. So it's just this little bit of extra that you're doing here to make up for the English language requirement and boost that you were getting in semester 1 and semester 2 with the diploma. And as I pointed out before, the entry requirement into IELTS is 6 into the first year, but you must pass before you can even do this intensive study period. you must pass IELTS with a level of 7 or an alternative exam with the same requirement. So really you want to be aiming at doing your IELTS exam around about here, around about October, so that you're sure of going into your placement in the beginning of the next year. So the clinical experience has already been described to you. It's a fantastic experience, and that's what you'll be doing in that January-February block. There are scholarships available for both pathways. So I talked about foundation studies briefly at the start, and the scholarship is 20%, which reduces the tuition fee, and the diploma in health is 15%, again reducing the tuition fee there. And again, your agent and Up Education can help answer questions about that. And that's probably all I need to tell you at the moment. Both courses are registered with Crikos. And I will now hand it over to, I think, possibly Sue or Nicole to lead questions.
Hi everyone. Shall we start with the questions? Let me have a look here. Okay, so first question, I'm not sure who this is aimed at, so I'm just going to say them. So are courses in person at the moment? What are the restrictions in Australia regarding COVID?
Can I answer that? First, the diploma courses are not necessarily in person. They can be done online, but it is required by the time you come to your placement and your simulation. In other words, by the end of the year, you do need to be in Australia.
Okay, great. And what are the restrictions regarding COVID at the moment? Is there anything that students need to know?
So from the Bachelor of Nursing perspective, you'll have to have a recognised COVID vaccination that's recognised by the Australian federal government. And that will be a requirement, obviously, as part of the travel, international travel into Australia. And that will be obviously updated as we've recommenced international travel here. But it's also a requirement for going out into clinical placement. People will have to have that COVID vaccination. And if they have been in an area that there have been maybe at risk or they have been diagnosed with COVID, they'll have to follow the same isolation and repeat testing process before they go out on placement. So it doesn't mean that you can't be in the course. It just means that you'll have to take care of yourself and then have a clearance test before you're allowed to go out on placement.
Okay, great. And can I do placements anywhere in Australia or only in Darwin?
So for the first simulate and placement after the UP program, Diploma of Health, that will be here in Darwin. So that's in a subacute care environment. So that could be in our hospital settings, it could be in our community aged care or residential care facility. But after that, you can do placement anywhere around the country that has placement available to you. So what students do like to do is they'd say, you know, this is a geographical location I'm really interested in, or I hear this hospital has a really good oncology department or a neurology department. Is there an opportunity for placement there? So we can tailor it to suit what your needs are and also what you'd like to experience as far in your degree.
Great. And can you talk a little bit about the practical placement in a bit more detail? You know, what will students expect? Working hours, things like that.
Yeah, so it's probably one of the most exciting parts of it because you actually get to feel like a nurse. So you attend a facility that's an accredited healthcare provider here in Australia, and you'll attend in a nursing uniform of CDUs, and you will start working a normal nurse's shift. So the rotating roster here in Australia can be a morning shift, 7 a.m. till 3:30, an afternoon shift, 1 o'clock till 9:30, or night duties. Yes, Night duties are included because they're a really excellent learning experience, and all the good stuff happens in the middle of the night. They usually start about 9 o'clock and finish around 7:30 in the morning. So you will work alongside your registered nurse. So you'll be doing all the hands-on clinical work under the direct supervision of a registered nurse. And when you move into that final placement, that registered nurse will be standing off and observing from a distance to make sure you're ready to manage patient care autonomously as a registered nurse. You also get, like in first year, no patient load. Second year, you're responsible for 2 to 3 patients. And then in your final year, you're responsible for 4 to 6 patients, depending on the location of the placement. So you're very much hands-on practice, so a work integrated learning experience. Your preceptors are providing feedback all the time. So they're acknowledging what you've done really well at, and they're also identifying where improvements need to be. And it's all assessed under the Australian nursing standards for practice. So it's not assessed by how many injections you've given or how many tablets you've administered. It's all assessed under the standards for practice, which is what governs us in our registration as a registered nurse. So that's really exciting as well.
Awesome. So I'm guessing there wouldn't be much time for working part-time alongside this degree.
So it's about self-management. So obviously it's 40 hours a week is the placement hours. So there is time to maybe do one part-time shift, maybe wherever you're working, but you do need a rest day. So you have to remember the public safety. So if you're working full-time and doing placement full-time, you're jeopardizing yourself, but you're also jeopardizing the health of the population, which the Nursing and Midwifery Board and CDU do not look fondly at. So you're putting yourself at risk. So we say that it's about a work-life balance. So maybe one day for a shift, but there has to be a rest day. And there also has to be rest time between shifts. Nursing shifts can be standing on your feet for a whole 8 hours with good cups of tea and biscuits in between, but you will then have to have some downtime to rest and get adequate sleep between shifts. Now, there is a minimum standard in Australia where nurses must have between 10 to 12 hours between shifts, and the students have that same luxury as well. So they're governed by the standards that the nurses work, conditions of working in Australia.
Perfect. And I'm not sure who discussed the IELTS. It might be Dr. Mark, but I think someone's asking, can you explain what the IELTS scores I will need, as in how high, how low?
You need to enter the Bachelor of Nursing directly, you need 7 for all skill levels, and to enter the Diploma of Health, you need at least 6 for all skill levels, nothing lower.
Okay, thank you. There is also someone asking, do you have any agents in the Philippines who can help me? Do you have any contact information that we can send into the chat?
Yes, let me jump in. Yes, we do have agents. I'll put some information into the chat over here.
Perfect. Yes. So if you are looking for any information, that will be coming your way in the chat. And the final question. I hear you can't study in Australia at the moment due to COVID. Will it be online teaching in 2022? And when can we re-enter the country? Is it open to students at the moment?
Let me answer that question. So obviously at the moment, the borders are closed for international students and tourists as well. But the individual state and territory governments are working with the federal government to allow for a charter flight, bring in international students from different locations. Obviously, Darwin University being the only university in Northern Territory, we are also working with the territory government as well as the federal government to bring in international students. These proposals are under review at the moment, once they are approved, then we will obviously send out that information to all our students to bring them on campus. Students who are in Darwin, they are able to come to the campus and study the program. But students who are offshore at the moment, some courses allow online study, some courses don't. With the Bachelor of Nursing, obviously, you have that option of placement where the student has to be on campus. So if there might be a possibility, as Mark mentioned, that a diploma course, they can start online and obviously do that course online. But with the Bachelor of Nursing, they can start online, but eventually they will have to come on the campus and finish. They won't be able to finish the course without that.
Of course, and I guess in that 1 year, the placement would be on hold until they can come over. Is that correct?
Yes, so I think that, sorry, Mark, go ahead.
So I was just going to say the diploma course does not have a placement until the end. So as long as they're here before December, really. Yeah.
Okay, perfect. Any last words really before we wrap up? No? Okay, awesome. Well, thank you guys so much for a brilliant presentation, and thank you to everyone joining us either on Facebook Live, or we will be sending this to you in the email either tomorrow or later this week. So if you haven't had a chance to join us live, you will get all the information in an email very, very soon. Any questions, please do send them over to us. They will be in touch with you very, very soon as well, just to give you some more information about the courses and how you can actually join and when you can join. Are there any, out of interest, are there any application deadlines, or is this open all year round?
So interestingly, because the nursing program is so popular with Charles Darwin University, for our direct courses for bachelor's and master's, actually we have filled the seats for 2022, which is not surprising from our side, but I think from a student, because the course is so popular, everybody wants to join CDU for the nursing program. Student can still submit their application for 2022 and obviously submit the application for the diploma course. So students who do not have that English requirement, they can start off with the diploma course online and then join the 2023 intake for the nursing course. So yeah, we are in a bit of a tussle here.
So thank you so much. That's great to know. And I think Michael just dropped his email in the chat. So if you do have any further questions about agents in the Philippines, please do email him and he will get back in touch with you. Thank you so much for joining, everybody, and we hope to see you soon. Good evening, good afternoon, good morning, anywhere you are in the world. Bye-bye.
Thank you very much.
So much.